if you're contracting with a substance abuse provider, what are they using? They're using a cognitive behavioral approach, or they're using a, talk therapy, 12-step. I got a program to send kids to AA meetings. You really think that's a good idea? I mean, what are they talking about? Right? Well, they're telling their stories, they're talking about I was this, and that works for people that, go through AA. You're going to send a 16-year-old there to hear that? I wouldn't, And let me ask you the basic question. What evidence you got it works? Because I've never seen any studies that say sending kids to AA is going to be effective. Because what are they thinking? That's not me. I'm not going to, and some of them are getting reinforcement. And besides this, and let me say this, and I know AA's work for millions of people and all that, but what quality assurance is there? Who knows what goes on? And I tell you what they do, court-ordered guys, they sign them in, give them their slips, because, they know they're not serious about it. They're not working that well. And there's no way for you to effectively monitor that, because there's no professional person running that group, giving you reports, working on the skills like you would if you contract with someone to do it.
Do you have any tools for assessing staff attitudes towards this?
I got a built-in asshole detector. We just did a training on staff characteristics and things like that, and one of my former students who does CQI for big agencies said they have looked and have not seen anything that's good out there. I will say that I think I have seen agencies start to go to more behavioral interviews. So when they interview staff, they literally they'll give them an assessment. I mean, they know they're not trained in it, but they'll give them a role play. They give them some things they want to see if they have the skills. There's a series of questions they ask around how would you handle this situation, how would you handle that, and what they're trying to see is are they punitive oriented. I do have tools that are designed to see if someone is more law enforcement oriented or service oriented. But I will tell you that the studies show it's the ones that are in the middle that are really the most effective. All right? If you're too law enforcement, of course you're not, and if you're too social work, you're not. Because consequences and accountability is part of the system, and so it's really that in the middle. But I think you have to change kind of what you look for in folks. How flexible are they? Firm but fair. How would they handle a situation? Is their first response is go for the spray? Or is it, well, I find out what the problem was, I'd work on that. We'd have because that's kind of probably what you want.
Well, and I worry too, and I don't know if you've encountered this in any localities, I worry too, how do you teach a skill set if perhaps you have that same risk factor? For example, perhaps if you have a colleague that you consistently hear come to you with, things that, I don't know, something that they're displeased that happened, and you're constantly hearing within those things, gosh, that's an item on the YASI, that's hostile interpretation of actions. So, if I'm the person that this is how I respond when things happen in my workplace, that no matter what happens, someone's out to get me and that kind of thing, then how do I score a child on that? How do I recognize it coming out of their mouth? And then how do I work with them on developing a different attitude or skill set?
But you hit on it. It's not just the skill. All right? There's two elements to good cognitive behavioral intervention. There's cognitive restructuring, and then there's the skills. All right? So I would say first thing to work on are the attitudes and the values and beliefs. You have to challenge that person's attitudes and their values. If I think it's okay to hit kids, all right? That's a value. I think it's okay. Kid gets smart with me. I don't have any problem, putting them down. All right? That's an attitude. A value. Values are more deep-seated than attitudes, right? And so if I've got that I have to challenge. All right? But once I've got you to think about it, just like with the kids, got them to recognize their thoughts. Because what does staff say? Kid come at me, I wasn't even thinking. I had to react, right? They don't realize there were thoughts going through that process, right? Then I got to work on the skills. So the skills without changing the attitudes probably won't get you very far, and vice versa. Just because I think different. I mean, you had a good example. You had a kid downstairs in that tape. Did he want to avoid trouble? Did he want to avoid that kid? Did he recognize what the consequences might be? Sure he did. What didn't he have?
Skills.
He didn't have the skills. In that case, it wasn't motivation piece, it was the skills. But don't you get some kids that are thinking, I'm happy with that, I can't get there fast enough, right? Well, what am I going to spend all my time practicing the skills for if he hasn't gone through the cognitive restructuring, the thinking, I haven't challenged those thoughts. So I go to programs and sometimes I'll say to them, you're cognitive, but you're not behavioral. Some of them behavioral, not cognitive. The behavioral model would be much more appropriate with very low functioning because it's root practicing, reinforcement, right? If you're dealing with developmentally delayed kids, things like that, you're not going to do a lot of the cog. But for most kids, it's going to be the cog and the behavior. And where I see the cog is they do these endless thinking reports. Okay? It's all about the thinking. And they never teach the kid the skills. So marry them together and you get the best effects. Remember, I'm motivated to do brain surgery. Would anybody let me practice on it? Why not? Because I don't have the skills, right? So it's not that I'm not motivated, right? And I think there's a little bit, I think you have to be careful with that, things like MI. You train staff on MI and they get people motivated and then there's no follow-up, right? That's kind of that's why ethics comes along, because if you train officers on MI, they got somebody ready to go, and then there's nothing to give them. So it's trying to teach them both. All right, that it? I'm tired. Everybody tired? I'm tired from my day.
I'm gonna stand from right here. But we invite you to stay on, even if you're tired. We have some nice social things this evening at reception. Please stay on and visit with us.
Yeah, we're staying tonight.
Thank you for being with us again, and both for this morning and for this afternoon. And I know you've been here to Virginia before. I can tell just by the number of people in the room and the types of questions that we listened with a different ear this time, and that we're in a different place. So thank you very much. We have a break. Please take all the challenging questions that I know this session inspired to the exhibit hall, and we reconvene at about 3:10 in the auditorium for a closing session.
Doesn't work, right? And then finally, my skier. Anybody in here ski or snowboard? Wow. Here's conceptually, there's a force at work for skiing. Gravity, right? You ever try to fight gravity? If you're skiing and you try to fight gravity and you get back on your skis or your snowboard, your skis take off and you're tumbling, you're out of control. Keeping your weight over the center of your skis and leaning into the fall line or into the valley actually helps you maintain control. Sometimes instinctively we want to pull back. We want to fight it. We go with it. Another way of looking at resistance. So a bunch of images to help you conceptualize this style. I hope they're helpful, right? And I hope that tonight these things are dancing in your head, right? I want them to stick. All right. Now, anybody remember Father Martin, Joseph Martin, who passed away recently? This was his quote. I didn't give him credit here because I don't think it was his quote necessarily. The attitude is the father of the action. You heard that before? Think about this for a second. The attitude. Attitudes, perceptions, thoughts, beliefs. Like, God, it's really cold in here. Which is not just a belief, it's a fact. Attitudes, thoughts, beliefs affect what? Directly. Behavior. Feeling. Okay? If my thoughts and my beliefs, right, are generally positive, then what you would expect is that the reactions, the behaviors are going to be generally positive too, and so on and so forth. In this field, at least for me, there have been times over 20 years where I thought, what the heck am